being a mom of 5 kids is a hard thing in general, but being a mom of 5 kids and all of those kids having special needs of some level and trying to figure out what those needs are can make things a little bit more difficult and complicated. So I wanted to give you guys a little peek into our life and the things that we're dealing with currently. So be sure to watch. Okay, so let's get started. Okay, so right now we have a lot of appointments going on for a lot of different reasons. So I'm gonna try to keep this as quick and simple as possible. But I want to start with giving you a list of the different things that we're trying to figure out right now so you can kind of see what we're looking at and juggling. Okay, so for my eldest, we are currently we need to get him a hearing test. He hasn't had one since he was initially evaluated when he was 3.5, and his school requested that he have an updated one because he's in special education and they just like to keep up on these things. So we have to schedule a new hearing appointment for him to have his hearing tested again, because now he is 10.5 and the last time he had it done was basically 6 years ago or more. So it's probably a good idea. We're not really expecting anything to be wrong, but it's just something that needs to be done. So there's that. Then recently we've been worried about him with his growth, with his weight and his height, because he is very small. He's always been very small. He's always been in the lower 10th percentile since he was a small baby, but he has slowly and more recently fallen out of his percentile, and even now he's stopped growing. In the last year he hasn't gained height or weight really, and so that's very concerning. He is on medication for his ADD, and so sometimes the medication can cause loss of appetite, but in combination with his loss of appetite, he is a very, very picky eater, and we have a really hard time getting foods into him and things that he likes. So we really just try to focus on the things that he likes so that he gets as much in as possible. That is a whole nother video, but if you want to know more about that, be sure to leave a comment and I'd be happy to make a video more about that. And then as well as that, he has a dentist appointment coming up. My next child, Dovey, he's actually doing really well right now. He's in a school that's really good for him. They give him a lot of support. He gets a lot of therapies, and that's why we love this school so much. However, it's not good for us in terms, it's a religious school, and where we are religiously, it doesn't really align with what we need going forward, and they expect certain things if he's going to stay there. So we have to start looking for a new school for him for the coming year. So that's kind of on our plate of figuring out where he's going to go and who's going to be able to help him, because there's not a lot of options here. He basically has the choice between staying in the school that he is currently at, which is very supportive but too religious, or going to a public school that would have a smaller classroom that they have for kids with autism issues. The problem is those classes usually are fairly highly functioning, and he is more middle level, and I'm worried if it would be enough support for him, because he would get help and therapy, but not quite as much as he's getting now. He gets a very intensive program where he's at, and that's what he really needs, and that's what we're hoping to find for him with the right structure. So that is our big thing for him. And then as well, we also checked on his growth and height and did all of that for him, because he is developing, he is gaining weight, and he is growing, but not at the rate that he should. He has fallen out of his percentile, not as bad as his brother, but he does still have a growth curve, which is good for him. So we're not quite as concerned with him, but because I was checking his brother out, we just decided to get him checked out as well for the same issue. And in order to do those things, what we're doing for those things is both our boys have to go for an x-ray, where they take an x-ray of their, I think it's their ankle or their leg, and then they look at the bone and they see how the bone is growing, and from that they're able to tell if they're growing accordingly, and if they're hitting what they need to hit, and if maybe they're just small or petite or whatever, and that's what lets the doctors know whether to be concerned or not. So that we're still waiting on the results from. And then with my third child, my eldest daughter, we have kind of been struggling with her all along since she was younger. She seemed to develop speech better than our boys, so we thought she was doing well, but she actually was is delayed in her speech as well. She's not as bad as them, but she definitely has significant speech delays, and those things have just kind of compounded. And even though we've had her evaluated and we've taken her several times and they don't think that she's on the spectrum, she has a lot of behaviors that we can't quite explain otherwise. And so she's been a big question mark for basically the last 3 years. We keep going for follow-ups. We keep trying to see what we can do to help her. But basically she has all the language issues of someone with ASD or autism. However, she doesn't have enough of the classic behavioral symptoms to get an autism diagnosis. So we're kind of left in this weird middle road conundrum of she presents, she has a lot of difficulty socially. She misunderstands things at school with her friends. She doesn't understand social interactions or social situations that she sees, and she will ask about them a lot to me. But even with those things, we've had a really hard time getting any clear answer for her. And she was in a special ed class last year that was specifically for kids with speech delay. And even in that program, they wanted her to get additional speech therapy because they couldn't give her enough because she needed so much more than they could give her. And that says a lot, I think, being in specifically a speech developmental preschool and them telling you you need more than we can even give you. So there's that. And this year she's in a small special ed class within a regular school, and she gets speech and occupational therapy. And again, they are saying she needs additional speech help that they can't give her. So they're asking that we get it outside of school. And so we went to our pediatrician, and our pediatrician is like, look, this just isn't working. You know, she's not getting the support she needs. And I'm like, yes, exactly. And so now she spoke with a neurologist who's familiar with our family history with my boys and my youngest daughter. And he suggested that we go to a psychiatrist to have her evaluated. So that is what we are doing with her now. So now we're setting up to have her evaluated with a psychiatrist, because up till now she's been assessed by the developmental doctor. So maybe we will find out something with that we didn't already know. Then with my younger daughter, we had just started the diagnosis process for autism because she has been presenting a lot of the classic symptoms. She's been presenting a lot of the classic signs and symptoms of autism. And so we thought it would be a fairly easy diagnosis, but lo and behold, it was not. So she went, and basically they said, yes, she presents all the classic signs and symptoms. However, when she did the psychological assessment with the psychologist, they said she performed too well. So they are on the fence about her because of this. And so now we have another question mark. So for now, she's supposed to start speech and occupational therapy, which she has an appointment coming up this week. No, not this week, in 2 weeks, where she's going to be assessed for those things, and then she'll be able to start getting therapy and help with those at least. So at least we're getting help for her to help her develop in the way that she needs in the meantime. And it's kind of a question mark on whether she has autism or not. And then finally with my baby, he is 9 months old, and we've been having a lot of concerns with him just because his eye contact is not very good. He tries to get away or look away a lot of times, or he'll look at us from the corner of his eye, or if he does make eye contact, it's very brief. And so with everything else going on with everyone else, we just feel like it's good to get him assessed and try to get any early intervention that we can get with him. So that is basically what we're doing now, is we are starting the process to have him assessed by a developmental team and just hopefully get him some sort of play therapy, because obviously he's too young for any sort of diagnosis. But we just feel like we already know that our kids struggle a little bit when it comes to developmental things, so it's not going to hurt him to get a little extra help. Okay, so that is the story on everyone, the quick of it. The thing I wanted to show you that I decided to do recently is I decided to take a calendar and write out all their appointments for this coming month. And then I color-coded them by child, so I have a better view of who has what and when, because I was starting to overlap appointments and double book, and that's no good. So I just wanted to share this quick tip with you guys that I did because I think it's really helpful. And so if you can see here, I just have like different colors for the different kids, and I've highlighted everything in the color and the day. And then on this side, I did like a little breakdown of who it is and what color they are. So that's my little hack for you guys. I hope you guys will find that helpful, if it helps you organize yourself a little bit better. and thanks for watching. Be sure to give this video a thumbs up and subscribe to my channel if you want to see more videos like this. Thanks for watching and have a great day. Bye.